I'd like to show our viewers right now what it is when you do get a joint replaced. So here we have an example. Doctor, take it away.
So this is your pelvis. Your head is up there. Your feet are down there. This is the femur. In a normal, healthy hip, your top of your femur has a ball on the top of it, okay? And this cup is actually called the acetabulum. That's Latin for vinegar cup, for all you nerds out there, like myself. The hip replacement replaces the bearing surface or the articular surface of that joint. So what we do is, similar to that knee graphic that we saw, the cartilage on the ball or the femoral head will wear out. So we take that out. And what we put in is usually a titanium implant with a hardened ceramic ball. And then in the cup, or the acetabulum, we resurface that as well, because that has also been damaged. And we resurface that with a titanium shell, or a titanium cup that gets placed into our natural, cup in our hip. And in between those two surfaces, we use what's called ultra-high molecular weight polyethylene, super fancy plastic. The beauty of this surgery is it can be done relatively easy in most patients. It can be stable immediately. You can get up and walk on it the same day. Some patients go home the same day, believe it or not. Most patients will stay overnight. Like I said, the success rate of this surgery is upwards of 98%. Now, that's not 100, so we're still working and trying and learning, and obviously we want to be better and better. But the reality is, if we look at the impact that hip replacement has had on patients' life, this is a surgery that's been titled the surgery of the century. That was a title given to it by an article in 2007 looking at the most impactful surgeries that we do in all of medicine, not just orthopedics. So hip replacement is an incredible surgery that can be done with great success. But yes, there are some risks. So there are some risks that have to be discussed and talked about. And when we're dealing with the surgery itself, every now and then, not often, but every now and then, we will see some of these issues that can come up around the surgery.